Okay, this next patient that you're going to see has a diagnosis of CVA, which is an old stroke, and Alzheimer's disease, with a very progressed state of Alzheimer's disease. He's not following simple commands, and he's having increased difficulty swallowing. You can see that he had significant aspiration. He did respond with a cough reflex, but as we go along, he's having more trouble. Now, this gentleman was on a mechanical soft and nectar thick liquid, and you can see that he doesn't have a very adequate oral phase with a lot of tongue pumping. The efficiency is not good. So our goal for this patient was to evaluate, including his diagnosis, prognosis, what diet might be safest for him if he continues to eat. And since he had some aspiration, but not significant amounts, no evidence of a pneumonia, just increased difficulty swallowing, then what we were looking at is what diet could be most appropriate at this point if he's going to continue to eat. You can see there was some trace aspirations there with no cough reflex. So kind of as he goes along, there's not as much of a response. But like I said, this is a patient with end-stage Alzheimer's. So we're looking at, should we place a PEG tube in this patient based on inefficiency, he's lost weight, and given the fact that he's end-stage Alzheimer's, and some of these strategies where we're alternating bites and sips, some passive things where we're giving him sour or carbonated seem to help a little bit. And also feeding this patient up to a point, where he starts to slow down, maybe stop at that point, is another strategy that might work. And then offering a few snacks throughout the day. You can see giving tactile cues is also helpful. For this patient, I think the big culprit for him would be trying to give solids to a patient who's at this high risk for choking versus aspiration. I don't see that he's got adequate skills to chew something and crush it. He doesn't have many teeth, if any at all. It looks like if he does have any teeth, it's one or two from what I can see here. So that's going to be a big deal. If you've got solids hanging out over the airway that's open like that, you're certainly at risk for choking versus just aspiration. So I did not give this gentleman solid foods to assess. I just made a statement about the risk for aspiration and the risk for choking with solid foods. So I didn't test those. I am trying to get him to follow some commands with maximal cues, and you can see that that's not very successful. He's having trouble just looking forward during the study. You can see that he's slowed down significantly. So the amount of PO intake is going to be a concern to the facility, but not if it's addressed in the context of this is a diagnosis where this patient is in an end-stage disease process. And end-stage means terminal illness, which it's hard for some people to accept that, but that's what we've learned about today. In this case, recommending a PEG tube may not be the best. He doesn't seem very uncomfortable with his eating. He's not aspirating every swallow. And his inefficiency and weight loss connected with that is going to be the same as with weight loss with the progression of his disease process. So you could document that and have the physician address it with the family.